Hi, it's Liam from Muscle Doctor, and if you've got tight hip flexors, I've got just the stretch for you. There can be a number of different causes for tightness in the hip flexors, and it's always recommended that you go and see a suitably qualified professional to have yourself assessed and treated specifically for your needs. But there are a couple of stretches that you might find help. And we're going to take a really good look at one of them with some variables and progressions that will help you with your tight hip flexors. This stretch should not be painful. If you experience any pain, then just back up and regress the stretch. Make it slightly easier for yourself. And if you don't get on with it at all, definitely go and get it checked out by someone who knows what they're doing. Ready? Let's go. Okay, beginning on one knee, we're going to step the other foot forward and gently drop down into a lunge. We're looking to feel a stretch on the front of the target side hip, no more than a 5 out of 10. So gently lunge forward until you feel that, and when you do, just take a few deep breaths there. We're trying to get everything to settle down, everything to relax in this side of the leg. And if we're pushing it too far too soon, then it won't be able to do that. It's going to tense up to protect. Deep breaths there. As things start to settle down, we can make sure that we've got our upper body nice and upright, chest up, elbow resting on the knee to keep us stable. Keep those deep breaths going. So with the next deep breath in, as you breathe out, we're just going to lunge a bit further forward into that stretch, looking not to push that stretch sensation too much above a 5. We need to be able to stay relaxed into it. When you find that new 5, hold it there and try and relax. Okay, for the next progression, we're going to bring the left hand down to the floor to stabilize ourselves. Right hand is going to touch the floor, and then it's going to come up and open out, palm facing the ceiling, and then come back. So that's going to give us a stretch of the deep hip flexors as a mobilization. So we're moving through the stretch. Let's go for 5 repetitions there. Last one. And back to that stretch position, holding there for a few moments. Deep breaths there. Okay, the next progression, we're going to use what we call reciprocal inhibition. Wordy term, it means we contract one muscle and its opposite, its antagonist, relaxes. So we're going to squeeze the glute here. So big hard squeeze of the glute, making sure that the upper body's upright. You'll feel that stretch sensation increase in the front of the hip due to the reciprocal inhibition, and also the fact that the glute is pushing the hip further forward now. 5 more seconds to go. Big hard squeeze. 3, 2, 1. And relax. And as you relax, just see if you can drop a bit further forward into that stretch. Give a good breath in and a breath out there. Okay, the final progression, if you're ready for it, if not, you can just stay where we are now, is to include rectus femoris, the big hip flexor that crosses the knee. So for that, we're going to bring the leg up off the floor, grab a hold of it with the fingers, and try and set yourself up there in a position that's tolerable, that's sustainable for you for at least 10 seconds. Bringing that heel closer into the bum if you can for these final 5. 3, 2, 1. Slowly let that leg down and very gently back up out of the stretch. Okay, let's swap legs. Left knee down, right foot forwards, and a slow lunge into the stretch until we feel it in the front of the target hip, which is the left side now. Elbow resting on the knee, upper body nice and upright. Keep that chest up. Deep breaths there as we settle in and acclimatize. No more than a 5 out of 10 stretch sensation. And as you start to settle into it, you can just refine your position, bringing the elbow back, helping you to keep the chest up. Holding there as we get everything in this target side hip to relax. deep breath in. And as you breathe out, lunge further forward into the stretch, not pushing it beyond your tolerance. Make it sustainable. Find the 5 out of 10. And now your job is to relax the target leg as you breathe in and out deeply. So let's bring the right hand down to the floor, just to stabilize yourself, and then left hand down to the floor to touch, and then slowly rotate, open out the chest, bring in the palm to face the ceiling, and come back. Tap the floor, and we're away again. Opening out the left side as we stretch that same side hip flexor. It's going to target the deep hip flexors. 2 more to go. Last one. And back into that standard hip flexor stretch. Take a deep breath in. And as you breathe out, we're going to squeeze that glute again. So big hard squeeze, this time of the left glute. It's the same side glute as the hip that you're stretching. Big hard squeeze. Feel that stretch sensation increase. And hold in there. 5 seconds to go. Big hard squeeze. 3, 2, 1. And as you release it, just see if you can drop even just a fraction deeper into the stretch. And hold in there. Big breath in. And a breath out, ready for the next progression. So again, try and keep that balance. Going to bring that leg up off the floor. Grab it with the fingers and try and settle yourself into something of a stable position. Hold in there. And as you feel things start to relax, if they do, we can slowly bring that heel into the bum a little bit further with these final 5 seconds. 3, 2, 1. Gently let the leg down and very slowly return to your start position.